Hello, everyone. It's Amanda from Intimate Rose, and I am so overjoyed to be joined by Amy Stein. Amy has been a prolific author in the pelvic pain space. She's a pelvic physical therapist with 2 clinics in the New York area. She authored Heal Pelvic Pain and co-authored Beating Endo. These terrific reads. Amy, I love these books because they are so patient friendly, but they are so descriptive. You don't leave any details out. So thank you so much for joining me today.
Of course. I'm very excited to be here. Thank you for having me.
Absolutely. So, Amy, you treat all the things and you treat all things pelvic floor, but let's talk a little bit about just your whole paradigm with pelvic pain, like what typically goes on in the evaluation and how you use this really lovely overarching approach to helping your patients manage pelvic pain.
Sure. So, one of the most important things is to get a connection with your patient. That's really important to make sure that they know you're listening to them and you're hearing them and you're hearing their story. That's probably one of the first most important things that you do as a clinician and for patients to make sure that you feel that you're that connection and that you're being heard. Then from there, really listening to the whole story too, because even the detail of, oh, I fell on my tailbone when I was 9 years old can play into whatever they're experiencing now, whether it's bladder issues or pain with penetration or irritable bowel. It's all connected. The pelvic floor, it connects from the pubic bone in the front, tailbone in the back. It surrounds the urethra, bladder, so it can have bladder symptoms. And that's important to ask the patients too, because not everyone divulges like, oh, well, I thought that was normal that I go to the bathroom every hour. And no, the bladder can hold 2 cups of liquid, and you should be able to go at least 2 hours. So having that conversation and education is key with our patients. Also, the bowel can be involved. So asking them questions about any bowel discomfort, any irritable bowel syndrome, constipation, explaining what constipation is, because some patients also, I go to the bathroom every day, but they go in pellets, and that is considered constipation even if you go every day. So making sure you're being very thorough in your evaluation, also asking about sexual health and what their preferences are, obviously, but what their main issues are and how we can help them, whether it is like a decreased libido or is there too much sensitivity in the area? Is there pain? Is there difficulty achieving orgasm? All these questions are really important to ask as a pelvic floor physical therapist. And then we also want to know, is there any orthopedic issue that's going on? Any back pain, hip pain, abdominal pain, any neck pain? All of these can also contribute to a patient's pelvic pain, abdominal pelvic pain. So the subjective part of the interview is key and essential. And then I like to go into education, educating them exactly where the pelvic floor is, what its function is, and how it can affect bladder, bowel, sexual health. From there, we look physically at the body as a whole. So what does their posture look like in standing? What does their posture look like in sitting? And by the way, even telehealth, we get a lot of information from that. I'm such a hands-on person, and I just like healing touch and being with the patient. I like the one-on-one interactions, and the telehealth, I was like, how much can we do? And I didn't realize how much we could do. And especially seeing people's home environments and like how they're sitting at home and how, on their couch, they're slouched over, on their keyboard. I'm like, I don't know. Okay, so we can work on that. So that's really important to look at the posture, alignment. You could even do a telehealth assessment, somewhat, not complete, but even at home with a patient, by having look at their alignment, putting, their hands on their pelvis. So that's important to look at how they walk, how they function throughout the day. also important. And then the part that I really enjoy the most is the hands-on. So really feeling what the tissues feel like externally. So abdominal wall, thighs, back, the glute area, seeing what, if there's an imbalance in the muscles and the tissue, in the bony alignment. Then looking at the internal muscles as well. And that is obviously there needs to be consent with the patient. If a patient doesn't feel comfortable, there's so much more as pelvic floor PTs that we could do, that we could skip that. We could reassess it later on. You could also have the patient do some of their own assessment. That can be really empowering to the patient. And then from there, we set up a treatment plan. Can they come in once a week or do telehealth once a week? Can they, do they need twice a week or every other week, once a month, that type of thing? We develop that plan together. And for a lot of our patients, we have patients that come from all over. So internationally, not right now, but we do have patients that come only for a week, and we really set them up with a whole program, what to do at home, how to assess their own discomfort. And that's also where a product like Intimate Rose comes into play. And I love your products.
Oh, thank
I'm
you.
not just saying that, I do really like your products. And the home program is key for a patient. So as a patient, if you're listening, if you're not hearing some things that are happening with your pelvic floor PT and you don't feel like you're progressing enough, take into consideration that there may be some things that the PT is not addressing. So that's important to understand too, that it does take time. The pelvic floor PT and home program, it takes time. So be patient, but communication with your providers, not just your physical therapist, is so essential. Letting them know what works for you and what's not working for you. If you do feel like you are plateauing from the PT, then either talking to the PT first, ideally, that's the ideal scenario, trying to figure out, okay, what are we missing here? And then if that's still not working, then seeking out a second opinion is what I would advise. But again, remembering that it does take time. And another very important factor is the multidisciplinary approach. So if a patient does have some irritable bowel symptoms, then really talking that through. As a pelvic floor physical therapist, I've talked to so many amazing nutritionists. So I'll guide the patient on, perhaps you should try gluten-free, dairy-free, low sugar, no sugar. So I'll give general advice, soluble versus insoluble fibers, chewing your food, that's key. Chewing your food. That alone could make your symptoms feel better. People just, myself included, I don't chew my food enough.
We get in a hurry.
We're rushing around, especially in New York City, anywhere. But so the multidisciplinary approach is also key. So finding a good nutritionist if you need one. We again give general advice, but I don't have training in it. I would love to do training, but there's only so much time in the day.
In your spare time.
In my spare time. So I really try to listen to the experts and give what I can, but I also know I'm not a nutritionist. I'm not a mental health therapist. Mental health therapy and mindfulness and really listening to your body and what could be increasing stress and anxiety, all of this plays a factor in your healing. Sleeping patterns, making sure you're sleeping enough, making sure you're drinking enough water. That's something that we hear quite a bit from patients. Well, I pee all the time, so I don't drink enough. And then you get constipated, and then that makes the pelvic floor worse. Another just tidbit of advice, which totally random here, and I apologize, but straining. I say in every interview I do, please do not strain. It only aggravates the pelvic floor muscles more. And it is an indication that there's either a dietary issue that needs to be addressed, or that the pelvic floor muscles are just, they're too tight. They're not relaxing enough. So they're not allowing for easy evacuation. So I'm sure I'm missing quite a bit, but I feel like I just talked your ear off. Oh, movement. Making
Yes.
sure you're exercising, making sure you're getting the blood flow, but also knowing your limitations. If sitting hurts, then doing the Peloton. Although some patients have said, I don't do Peloton, but I know you stand up a lot. So maybe that's not a good example. But spinning, I've had so many patients with spinning that their tailbone hurts more, or their nerve irritation gets worse. So really finding what works for you is really important, whether it's swimming, doing yoga at home, doing just dance with your child at home, which I've been doing to get moving. So finding that balance is really important. And yeah, I can't stress enough the communication with your provider, the multidisciplinary approach, and really wanting to do your home program too. That's essential.
Absolutely.
I can keep talking, but I'll stop.
No, you get to say whatever you want. And one of the things that I wanted to highlight that has become, I think, quintessential to you and is such a great example is what a quarterback you are for your patient as a pelvic PT amongst all these different kinds of providers. And a good pelvic PT will be that, as a member of that core team that is going to help say, I think you need to see a nutritionist, or I think we could do some cognitive behavioral therapy. Here's a great counselor here. And so we want to be making sure that our patient gets that all-inclusive care. And you highlight that in both of your books. And I think that that's just really important too for patients to know, and for clinicians to strive to be more like, is that we've got to be looking for these collaborative relationships and finding the great providers that are going to take good care of our patients so that the buck doesn't stop with us.
Yes, I agree with the quarterback. You need someone. Some patients, it is, more straightforward. They may just need one or two providers, but some patients really need that quarterback to navigate the system, to realize that there are people out there that can help them. And if there's one other thing I have to say, is that there is hope and there is help out there. You do have to find it, though. Sometimes it kind of lands in your lap, like someone like Amanda, but other times it's not that simple. So keep looking, keep striving for your right team.
That's perfect. I love it. So well said. Another thing that I really like that you talk about is mitigating exercise while you're going through the rehabilitative process to allow for decreasing of the inflammatory state. So talking about somebody, so I'm one of them, runners and people that really enjoy some of the more endurance and high level activity, and that maybe that's a mechanism of coping. But while we're going through this rehabilitative process, we may have to tail back on that a little bit. And it's not that we can't ever have it back, but it's just that during the process of resting and healing and getting a good motor control of the pelvic floor and the abdominals, that we may have to tailor that back and find other things that are really satisfying to us in the meanwhile. But it doesn't necessarily have to be yoga, right? It doesn't necessarily have to be like lay down on your back and be quiet and breathe and get haunted by your own thoughts. And for some people that works brilliantly, but for others, it's just going to have to be something else, like going for a walk instead of a hard run and those kinds of things.
Yeah, in the Beating Endo book, Dr. Orbach and I do go into, like, she's a big yoga person, and I love yoga. I'm just not as big of a class person. I do like to kind of do my own thing. Also, because I have a bunch of injuries, so when I can't do certain poses, I'm like, oh.
Humbling as a PT, isn't it?
Yes. So yes, even going for a meditative hike in the woods, even here in New York City during the pandemic, I was making sure I was going outside, and I would try to find, actually it was pretty quiet here for many months, so which is crazy. But I would just we're right near the East River, so I would walk down to the river and walk around along the river and just look at the views. And so really finding what works for you is important.
That's great. I love it. And so, how do you educate patients in something like the dilators or the wand? What are some cues that you love to use with either of those tools?
So first, I do want the patient to feel comfortable using a dilator or wand. And I usually, the, the very first thing I do is I go over deep breathing with them and trying to calm the system down, making sure they're also doing the deep breathing correctly, because that's something that we find that is all across the board. Like some have shallow breathing, some just breathe into the belly and nowhere else. So really going over deep breathing, and the inhale can be a little bit shorter than the exhale, making sure they're not feeling like they're hyperventilating, those types of things. And then with that, learning to relax the pelvic floor, because a lot of our patients do walk around with the pelvic floor tight, and that's what causes the restriction and some of the pain or other symptoms, bladder, bowel. So making sure they understand where the pelvic floor is, to really educating them, making sure they feel comfortable. And then what I have them do actually before the dilator and wand is I actually have them learn where the perineal body is. And that's the tissue between the vaginal opening and the rectal opening. With the men, it's just the tissue between the genitals and the rectal opening. So I teach them where that is first. And then I have them use like gentle pads of their finger to palpate or touch that area and do like a gentle massage. And I'll explain it to them, like just gently hold on that muscle. So it's just like any other muscle in the body, it's just in a more intimate area. But you need to feel comfortable working on that area. We want that area to heal if that's their primary complaint, and we want to show you how you could do it on your own as well, giving them the power so that they feel empowered.
Yeah.
Once they feel comfortable with that, so I'll have them do that for a week, report back, how did it go, what did you feel. I'll show them positions to get in to work on that area. And then from there, as long as they feel comfortable, then I'll say, okay, now let's take the dilator or the wand and let's press that on that area and get comfortable with that. And then depending on the patient, I may say, okay, now take a week, come back, try to put a good amount of pressure right at the perineal body. See how you feel. Try to do it every day, every other day. If that is good, or if after the first session I feel like they could try more, then I will actually have them insert it after they worked on the perineal body first to try to loosen things up, to get comfortable. Then I'll have them use the dilator or the wand. I'm very systematic about it so that I know what's working and what's not for them. So I typically have them just work on one area if it's the wand, which is more of a curved product. I usually just tell them, okay, let's just work on 6 o'clock, which is at the bottom. So it's the area that connects the vaginal opening to the rectal opening. If it were male, reverse side, I'll still have them just work on like one area, report back to me next week, do the deep breathing while you're working on these areas. And then from there I progress. Okay, now let's go to 5 and 7 o'clock. How do you feel with that? And then once they get comfortable, then I'm like, okay, you're doing great. So now you don't always need to work on every single area, just like if you were to have a trigger point here. So now what I want you to try is when you go to do the wand or dilator, try to press on areas and see where it feels tight or painful. Then I use a pain scale because I think that's really important. I prefer 3 out of 10 pain. So 10 being the most pain, 1 or 0 being no pain or very little pain. I like to use the 3 out of 10 as their max point so that they feel comfortable doing it and so that they want to continue doing it. Because I find that when they get to 5 or 6, they're like, oh, I'm not doing this anymore. So that's key as well. And then what I was saying before is that they learn to find where those tight spots are and those trigger points are. So in the beginning, it can be more intimidating, but I do find that once a patient gets used to it, they feel really comfortable with it, and they become more experts than I am. So yeah, so it's very systematic, a lot of communication with the patient, because you don't want them to get discouraged. You want them to continue with their home program, and home program is so essential. Patients only see us 1 hour, maybe 2 a week, and doing the home program and doing it regularly is key to their recovery.
That's great. I love it. And that's very in tune with how I practice as well. And it gives us soft delivery into independence too.
Yeah.
It's kind of like a runway for an airplane to take off and to be on its own.
Oh, I like that. That one.
Wheels up.
That's awesome.
That's great. Is there anything else, Amy, that you would like to share with people that might be experiencing pain, or clinicians that are trying to help their patients reach their goals more?
Sure. Yeah. I mean, I think with regard to the home program, the dilator one is just a component. So I do think that even just practicing breathing on an hourly basis, ideally in the beginning, because if they're experiencing a lot of pain or bladder frequency, urgency, really practicing that deep breathing, doing a stretching program that feels comfortable. We already talked about getting cardio in there somewhere and doing what they like to do. And then, and if dilator wand is appropriate, trying to get them to do that on a regular basis. And again, monitoring their symptoms. And yeah, just knowing that there are people out there that can help you. I think that's another really important point, and that it is a journey, but we're there with you. We're your quarterbacks.
That's right. We're on your team.
Yeah.
That's brilliant. And Amy, how can people find you? Where on the web and where on social media are you?
So my company is beyondbasicsphysicaltherapy.com, and we have a blog. We just did a whole rebranding. So we're still working on the kinks of our website and our social media. Our social media is at Beyond Basics PT. And we're on the various channels, Facebook, Twitter, Instagram. I think we're on Pinterest still. I'm not sure, but that's where you can find us.
That's so wonderful. Well, thank you so much, Amy. I very much appreciate your input and your time and your expertise. And I know that our viewers will as well.
Thank you. And thank you for all you're doing to help our patients as well. So I appreciate it from my end too.
Thank you, Amy.